Arthritis and osteoarthritis. Patterns of joint involvement. Do you know the characteristic patterns of joint involvement in different arthritic diseases? We'll be showing you just that in Part 3 of our Chalk Talk series on arthritis and osteoarthritis. Knowing the patterns is quite helpful in pinpointing the type of arthritis. To first illustrate the patterns of joint involvement, we've marked the most important joints in this image. The shoulder girdle consists of the sternoclavicular joint, the acromioclavicular joint, and the glenohumeral joint. The arm comprises the elbow, wrist, as well as the finger joints. Let's take a detailed look at the fingers, as knowledge of the anatomy of the joints is important for the differential diagnosis. Each finger consists of metacarpophalangeal joints, which are separated from the proximal interphalangeal joints and the distal interphalangeal joints. These are easy to remember as an acronym. The distal interphalangeal joint as DIP, the proximal interphalangeal joint as PIP, and the metacarpal phalangeal joint as MCP. The MCP joint of the thumb is also termed the first metacarpophalangeal joint and needs to be clearly differentiated from the carpometacarpal joint, which connects the thumb to the carpal bones. In contrast to the fingers, the thumb has one interphalangeal joint. The individual vertebrae of the spine are connected by small facet joints. On each side of the lower spine are the sacroiliac joints, in short, SIJ. The lower limb consists of the hip joint, knee joint, as well as the upper ankle joint. We can also see the joints of the foot. The metatarsophalangeal joints, or in short MTP, PIP joints, which are located between the proximal and intermediate phalanges, and the DIP joints, which are located between the intermediate and distal phalanges. Let's not forget the two joints of the big toe. The first MTP joint is located between the metatarsal bone and the proximal phalanx, whereas the interphalangeal joint of the big toe is located between the distal and proximal phalanges. Well, this may seem somewhat overwhelming at first, but we'll be taking a gradual approach in explaining their significance in arthritic disorders. Now let's move on to the most important guiding principles used in classifying the distribution patterns and the number of joints affected. Let's first look at the differences between large and small joints. Large joints include the glenohumeral joint, elbow, hip joint, knee, and ankle. These large joints can be differentiated from small joints, namely the joints of the fingers and toes. The wrist is also made up of several small component joints and is considered a small joint. In addition to differentiating joints into small and large joints, another means is to look at whether the joints of the body axis or the extremities are affected, that is, if there is axial or peripheral joint involvement. Axial joint involvement affects the spine or sacroiliac joints, whereas peripheral joint involvement affects the joints of the arms and legs. An important aspect to consider when determining the pattern of joint involvement is whether it is symmetric or asymmetric, or in more specific terms, whether there's bilateral involvement of the same or different joints. For example, bilateral small joint involvement of the hand is considered symmetric. By the way, the MCP and PIP joints of the same digits on both hands aren't necessarily in an identical distribution, resulting in a mirror image effect. Symmetric involvement is also found in bilateral involvement of the MCP and PIP joints, which affect different digits. Let's take a detailed look at this example. Here, we can see that the MCP joints of digits 2 to 4 are affected and represent symmetric involvement. The PIP joint of digit 2 on the left and the PIP joint of digit 3 on the right are also affected. Despite this pattern of joint involvement, it's still considered symmetric. In contrast, the pattern of joint involvement in different digits is asymmetric, as shown here. The second and fourth digits are affected in the left image, whereas only the fifth digit is affected in the image on the right. Each pattern of joint involvement indicates a different condition. As well as determining the distribution pattern, another aspect to consider is whether the upper or lower extremities are involved. Finally, let's look at the number of joints involved. Single joint involvement is termed monoarthritis. If 2 to 4 joints are involved, It's defined as oligoarthritis, which is derived from the Greek word oligos, meaning few. The involvement of at least 5 joints is termed polyarthritis. However, the number of joints involved should also be considered in the disease course, as the number of affected joints can increase gradually. So it's important to remember that oligoarthritis can begin as monoarthritis, and polyarthritis can develop from monoarthritis or oligoarthritis. Though it has been proven to be useful to classify the conditions according to whether they occur as monoarthritis, polyarthritis, or oligoarthritis. We'll be taking a detailed look at this classification in the next episode, but for now, it's time for the quiz.